This is Steve Zelser with WorkWeek and Pacifica, and we wanted to cover today a strike of the NUHW healthcare workers in Los Angeles that are striking Kaiser and fighting for better conditions for themselves and their patients. And joining us is Kassaudra Guiterrez-Thomson. She's a therapist in Los Angeles and is on the bargaining committee. So welcome to our show, Kassaudra.
Thanks so much for having me. I really appreciate it.
So Kassaudra, why don't you talk about the issues that led you and your fellow union workers to strike at Kaiser, Southern California?
Well, I myself have only been at Kaiser about 2.5 years, and I'm a psychiatric counselor, and I actually just became licensed this last Monday. So I've been an associate, which means I'm kind of in Kaiser's training program. And I mean, immediately it's been overwhelming working at Kaiser. You just learn really early on that Kaiser is understaffed and that we have many patients in need and that there's just not enough availability or resources or time to really serve our patients. And so we were really encouraged and emboldened by our colleagues up north, right, and their 10-week open-ended strike. And unfortunately, it seems like the only way to keep Kaiser accountable or to actually see change is through a strike. So, pretty early on, I think the union was preparing us that let's go to the bargaining table. Let's really try in good faith to get a fair contract. I think we were hopeful that Kaiser would offer us similar parity to what our colleagues had up north, and perhaps we could have a positive bargaining process. But unfortunately, pretty quickly, it was clear that Kaiser was not going to offer anything that was similar to what our colleagues already had. And so we've kind of had no other option but to go on this strike in order to ask for parity. But everything we're asking for is exactly what our colleagues up north already have. We're asking for the same amount of patient care time. That's just indirect time to be able to respond to our patients' emails, calls, to look at their chart before, to thoughtfully think about what they need in terms of treatment planning. If we have to do documentation, if we have to file reporting, we get only 2 hours protected in our schedule each week for that. That's about 3 minutes per patient we get for anything outside of that face-to-face clinical time, whereas our colleagues up north get 7 hours. That is a huge, huge difference. And so many of our clinicians and providers are burnt out. We literally don't have time to go to the bathroom. Our patients feel it. We're kind of running from session to session. And so having 7 hours like our colleagues up north, it's still not enough time to really do what we need to do, but it's so much more. And so that was one of the big things we're asking for. And we're asking for parity with wages. We're definitely underpaid compared to the medical side, but we're even behind our colleagues up north. And we're also asking for our pensions to be restored. So again, our colleagues up north were able to keep their pensions, and Kaiser took our pensions away, I believe, in 2015. And so, we're one of the few unions and groups of employees at Kaiser, nationwide that doesn't have pensions. And so we're asking for those to be restored. So those are the three big things I would say, along with safe staffing for some of our other departments. But it was pretty clear, we're asking for things that our colleagues already had. And so we were hoping that Kaiser would really start the bargaining process at a fair place and say, let's try to bring you up to that level in parity. And that's not at all been what's happened. And so that's why we're out striking.
And Kaiser has a long history of being fined and charged with violating federal law, which requires that they give proper treatment for people who have mental health conditions. And they've been fined millions of dollars. And they seem to disregard the law, the protection that patients should have. You're saying that you really don't have proper time to properly take care of the patients that you're seeing. Is that one of the issues?
100%. I mean, therapy was meant to be practiced in the context of a relationship, right? Meaning I should know my patient's name. I should be able to, know their story. And so if you're seeing a patient a lot of our clinicians can only see their patients every 3-4 weeks. It used to be 6 weeks, even worse. There's no way for every time it feels like for the patient, you're starting over, right? And so if you have 2 minutes before to quickly look at the chart and go, okay, what's their name? What's their partner's name? Wait, what are they here for? What are we working on? What are the goals we did in our last session? That doesn't translate to a relationship, right? Where your therapist knows you and your therapist is really, has the time to really to treatment plan. And so I don't even have time often to make eye contact with my patients. I have to intentionally go, okay, let me give 5 minutes of solid eye contact, because you're kind of expected to do your notes synchronously, like while you're in the session with the patient. Otherwise, there's no way you'll survive. You'll be, staying after work for 2 hours to finish your notes. And so this is such human work. This work is supposed to be done in the kind of context of a relationship, and every patient brings in their own story and really has their own needs. And it's really unfortunate. I really believe our clinicians are doing the best that we can, but Kaiser staffs one therapist for every 3,000 patients in Southern California. I mean, the caseloads are tremendous, right? And so it's just the expectation on us to provide quality, human-centered healing work with the kind of factory-like settings. It's really our patients who lose out. They get the short end of the stick. The clinicians are burnt out for sure, but our patients really are not getting the treatment that they deserve. And Kaiser will say it's investing in their mental health, but again, I think they're saying the $50 million they were fined by the state of California last year. I think they're spinning that as part of their investment. And I think honestly, it feels like their business, it's better for them to incur fines. That's like almost like part of their budget, it seems like, versus actually investing. They have the resources to really make their behavioral health department like to be leaders, right, in the industry. They have the funds to do it, but unfortunately, it seems like they'd rather be fined or held accountable and then have to make changes.
And it sounds like mass production healthcare, where the patient is put secondary to apparently increasing their profit. They say they're a nonprofit, yet it seems like they're making a lot of money, billions of dollars, and that money is not going as much to patient care as it should be going. Is that what you're saying?
Completely. I mean, I've been told that they're sitting on a surplus up to $60 billion, right? There's reserves. Our CEO is paid extremely well. I hear he has 10 pensions. And, here we are fighting for one pension. And so it really does, again, it seems like our patients have to advocate for everything that they get and need, right? It really feels like a fight. And it feels like we are always expected to do more with less.
And the result in Northern California during a number of the strikes that NUHW had, they had parents of children who committed suicide because they didn't get treatment. People were not getting appointments promptly. And
Mhm.
as you know, as a therapist, if you have serious health problems, mental health problems, you need care immediately. So the trauma that patients and the stress that patients are going through must be really depressing to therapists who want to help them and deal with their crisis.
Yeah, I mean, my colleagues who work with patients in crisis, I can't even imagine. I've heard them share that, a patient has just, maybe they were just hospitalized because they were actively suicidal, and that pretty much a patient has to stay actively suicidal in order to be given the level of care they really need. And so many of those clinicians who work with crisis patients really feel like they're not equipped with the time or the resources to actually meet those patients' needs. And a lot of them fall in the cracks until they're in their next crisis episode. And, I work with a lot more mild to moderate to highs, moderately high acuity. And those patients, if we were able to actually treat them weekly, right? And I work in a program where we're given half-hour appointments, and that's about 20 minutes of clinical time because we have to schedule their next appointment. So 20 minutes of clinical time is not really what I think that, the community standards are for therapy. But if we were able to treat patients weekly, even biweekly, consistently, I think we would see less patients then having crisis down the road, right? Because we'd be able to actually teach them skills, stabilize them. They would feel like there's a relationship with a therapist that they can check in with. And unfortunately, it feels more like as patients are in crisis, they call, they get immediate help, and then there's nothing sustainable for them. There's not a system for them to really continue get to that level of care. It's either crisis or, Kaiser's also will say we provide a lot of tools, and there are some great tools, but the Calm app, which teaches mindfulness, is not the same as being in therapy, where you are getting the specific tools that you need per your diagnosis and your struggles. And so I really feel like Kaiser touts this kind of preventative model where people are given some kind of standard tools, or it's the immediate crisis. And there isn't, there's a lot of patients that just kind of stop trying, because if you have pervasive mental illness, it takes a lot of effort if you're the one that has to call and track down, your psychiatrist, or try to get seen or try to get an appointment. That's a lot to expect of a patient that's really going through crisis.
And it sounds like it's on the individual, and the stress and uh, kind of mental health problems, especially were exacerbated during the COVID pandemic. But in the United States, there's a general mental health crisis, which is very serious. Do you think that Kaiser, and as a matter of fact, all these nonprofits are really dealing with the depth of the mental health crisis we face in the United States?
I mean, I think to your point, this is a huger, larger systemic issue. I think, there's an epidemic of loneliness. I think a lot of people, as our world moves more towards a virtual space, there's a lot of people who don't get that in-person interaction or are not having the quality of relationships. And so, I think we're seeing rising rates of depression. We see rising rates of anxiety as people kind of had to reemerge in this world. And so it is bigger than just Kaiser, but specifically at Kaiser, it's a staffing issue. We frankly don't have enough therapists and clinicians. And, patients should be getting quality mental health services weekly or bi-weekly at minimum, right? And a lot of patients are just being seen every 3 or 4 weeks. And that is not how therapy was meant to have. That's maintenance. That is someone who has been in therapy and is really stabilized. And we're kind of, at maintenance before we can kind of graduate them from treatment. And so, you know, Kaiser is 100% needs to staff and then have more therapists. If this was happening on the medical side, right, of their house, there would be a lot more scrutiny if people were not able to, if they were supposed to be getting weekly care and then they were seen every 3 or 4 weeks. But because it's mental health, I think they get away with it. It's, and so a lot of, I think patients again just give up and suffer quietly, or they pay out of pocket. I hear about that happening a lot too. Our patients are paying out of pocket to get quality care, versus demanding that Kaiser provide it to them. So I do think there's an epidemic specifically of loneliness and depression, and I'm seeing rising routes of anxiety. But and Kaiser frankly needs to have more staffing and more providers.
And what is the excuse that Kaiser gives about why you can't have parity? It's a company that operates in California, Southern and Northern California. Why not have parity with Northern California workers? You have the same prices, you have the same problems and issues, economic issues that you have in Northern California.
That's a great question, Steve. And as someone who actually grew up in Northern California, and I've been a Kaiser patient pretty much my whole life, when I moved to Southern California, I was very shocked from the patient experience of, wow, there's no, my chart doesn't transfer. It's two different systems. And now working for Southern California Kaiser, it seems like it must be to their benefit that it's two different employers, two different systems. Imagine if Northern California and Southern California mental health providers were all in one union, right? Imagine that. Imagine our power if we were able to strike all at once versus it having, two separate unions. And so it's very confusing. I don't feel like they've ever provided a great answer when we've asked, why can't we just have parity with our colleagues? They'll be very defensive. I'm on the bargaining team and I've been at the bargaining table for every bargaining session, and they will say, it's apples to oranges. They'll say it's different contract, that's a different, it's a different system. And we're like, no, it's not. Help us understand. Of course there's going to be some nuanced differences, but for the most part, it's very similar. And they will get very defensive. And again, apples to oranges. They won't engage in the conversation. We've asked them, why don't we deserve pensions? They won't even say the pension word. We call it the P word, almost jokingly. They'll just talk about retirement benefits. And so they're very dismissive. They won't even engage in meaningful conversations where they're even giving us the facts, the figures, the reason why. And so, your question's as good as mine, Steve, and why we're so different, or why we don't deserve what our colleagues have.
And the issue of the state of California, couldn't the state of California say that nonprofits that operate in the state, if they healthcare workers, they cannot manipulate one group against another and require that you have the same contract statewide?
I don't know the answer to that. I wish I did. That would sound great. I know that NUHW is fighting for parity, right? Laws of parity, that we have the same, that we should be treated the same and receive the same as the medical side of Kaiser, but I can't speak to that about Northern and Southern California.
And there are a large number of trade unionist workers, unionized workers in California who are members of Kaiser. What should they do, and how are they being organized to support your effort for your demands for better treatment for yourself so you can treat the patients who need the care?
Yeah, this is my first experience being in a union. And I have to say, one of the most beautiful things has been when I have felt the solidarity from other union members. And I was in San Diego a couple of weeks ago. Kaiser was one of the largest sponsors for a benefits conference, and it was at Petco Park. And they spent, of course, thousands of dollars to be a sponsor, and they were hosting this specific wine and cheese event for participants of the conference, and it was pretty much all union. It was very, high union attended, and so we were picketing and leafleting outside, and there were all these union members, sheet metal union, electrical union, CTA, the California Teachers Association, that had been invited to this, kind of classy wine and cheese event. And when they saw, they're like, "No, we will not cross a picket line." And when we told them, especially if you're in a union, you get how devastating it is for your pension to be taken away, right? And when we kind of told them what was happening, they're shocked, right? So a lot of these individual folks that we talked to were really concerned. They were not the chief decision makers, right? But we had a great letter of support from the California Teachers Association, specifically, demanding that Kaiser resolve this and get to the table because, their members' services were being impacted. So what I would say is, any individual person has power to, speak to their own union and say, "Hey, our collective power as buyers, right, of this insurance." That actually would push, hopefully, Kaiser to even get to the table and negotiate with us. And so we have felt the solidarity from our union siblings in terms of, as they feel our pain. But collectively, if people were able to kind of push the decision makers of their union to question purchasing Kaiser again, or to put pressure on Kaiser to actually resolve this and to offer us a fair contract, that would be huge for us and very helpful.
And of course, a large number of the members of Kaiser are union members. So if the state Fed and the labor movement said, "We're not going to tolerate this situation," that would have probably a radical effect on Kaiser.
I really think it would. It would be amazing.
Good. Okay. Well, what can people do who want to support you?
The first step would be to go to a website, www.kaiserdon'tdeny.org. There's a petition you can sign just that you support us. We have a GoFundMe, of course, because every day that we can keep our workers out is more meaningful. So if people want to contribute financially, if people want to come to a picket site, we are picketing all across Southern California, from San Diego to, Bakersfield. And so we have picket sites every day of the week that people can join us. And then also, if you are a Kaiser member and your care has been denied, it is so helpful if you write to us. You can write to research@nuhw.org. We want to hear your story. We are working with the Department of Mental Health of California to actively, report anyone whose care is getting denied or delayed. We're trying to track this, and so that's really helpful. DMHC has set up a hotline where you can call yourself and report if if you've been delayed care, if your appointments have been canceled. That's one of the most helpful things people can do. And all that information is on kaiserdon'tdeny.org. So that would be the helpful steps for people who want to help or get involved.
Okay, well, thank you very much. We've been talking with Kassaudra Guiterrez-Thomson. She's a therapist at Kaiser, Southern California, fighting for pensions, fighting for better conditions so she can help the patients that she wants to help get well. So thanks for joining us.
Thank you so much, Steve. I really appreciate your time. Thank you for the solidarity, and thank you for the support.